Hello everyone, I am Dr. Amit. Welcome back to my channel. If you haven't already, please hit that subscribe button to stay updated with my latest medical lectures. Today we are continuing our respiratory series and we are diving into a fundamental topic, that is lung physiology, especially the lung volumes and capacity. Okay, so in this video we'll talk about inspiratory reserve volume, tidal volume, expiratory reserve volume, and residual volume. And in the next video we'll talk about the capacity: inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. And we also try to understand this figure because we most often found this figure in most of our textbooks. Okay, so let's start our topic with tidal volume. So total we have 4 volume and 4 capacity. Okay, and always remember that the capacity is a sum of more than or equal to 2 physiological forms. Okay, so this capacity always is the form of at least 2 or more than 2 of these volumes. Okay, so now we'll talk about tidal volume. Okay, so just think that whatever the airs, okay, so air that moves into the lungs with each quiet inspiration, or we can say that amount of air that moves in or out of your lungs during a normal or a relaxed breath. Okay, so that is your tidal volume. Okay, while talking about the statistic, okay, so it is 6 to 8 ml per kg, or typically around 500 ml. Okay, now we'll talk about from clinical significance point of view. Okay, so we'll talk on 3 points. Okay, body size, lung health, and exercise. Okay, so while talking tidal volume, in case of body size, taller person always have larger tidal volume than shorter person. Okay, the second thing about lung health. Okay, if the lung become stiff or if the lung become diseased, okay, then the tidal volume become small. Now, while in term of exercise, uh, whenever you start doing exercise or running, your tidal volume will increase because the body needs more oxygen, and to compensate that, our body increases the tidal volume. Now that finishes our tidal volume. Now we'll talk about inspiratory reserve volume. Okay, so just think that this is your extra inhalation. Okay, so if you breathe normally, okay, just what's here written is air that can still be breathed in after a normal inspiration. Okay, that will be your inspiratory reserve volume. Okay, so in clinical setting, what are the steps you can follow? So you can ask your patient to breathe in normally. Okay, that will be your tidal volume. Now in step 2, instead of breathing out, keep inhaling as much as you possibly can. That extra air from the step 2 will be your inspiratory reserve volume. Okay, so from statistic point of view, so the normal value will be 3000 ml, or you can say that 3 liter. Okay, so we can see that it is much larger than your normal breath. Okay, why? Because our lungs have a massive capacity to expand when the body needs more oxygen. Okay, so why this inspiratory reserve volume is important? So it is important because the inspiratory reserve volume actually tells our muscle strength. Okay, whichever muscles we use during inspiration and expiration. Okay, and it also tells us about lung compliance. Okay, how stretchy our lung is. Okay, so this covers our inspiratory reserve volume. Now we'll talk about expiratory reserve volume. Okay, so let's go the other way. Okay, after a normal exhale, try to squeeze out every last bit of air using your stomach or chest muscles. Okay, that will be your expiratory reserve volume. So air that can still be breathed out after normal expiration. Okay, so in clinical setting, you can say to your patient that breathe out normally. Okay, that will be your tidal volume. Now in step 2, you can say that stop at the end of breath. Okay, now the forceful exhale. Okay, now use your stomach or chest muscles to squeeze out every last bit of the air you possibly can. That will be your expiratory reserve volume. Now talking about the value, the normal volume will be 1000 ml to 1200 ml. That will be around 1.2 liter. Okay, so normal breathing is passive. Okay, breathing out, but expiratory reservoir volume, whatever the amount of air you will exhale at that time, active contraction will be in the intercostal muscles and the abdominal muscle. Okay, now we'll talk that why it is important. So it is important because the expiratory reservoir volume tells us about the power of muscles. Okay, that is intercostal muscles and abdominal muscles. Then in case of obesity and pregnancy, the expiratory reservoir volume will decrease. And in case of airway obstructions, like in the disease stage of asthma or COPD, the air get trapped in the lungs and the expiratory reservoir volume will decrease. Okay, so this covered our expiratory reservoir volume. Now the next is residual volume. Okay, so just think it as this is the air that never leaves our lungs. Even after you blow out as hard as you can, some air stays in the lungs, okay, to prevent them from collapsing. Okay, so residual volume is the air in lungs after maximal expiration or exhalation. Okay, so we can say that residual volume, okay, just remember this line. Okay, residual volume or any lung capacity that includes residual volume cannot be measured by spirometry. Okay, so why this is important? Okay, because residual volume, we also say that anti-collapse rule. Okay, that is, it prevent atelectasis because the residual volume keep the alveoli open. Okay, then residual volume makes our lung easier to reinflate when you inhale the air. Okay, so the average volume will be 1200 ml, and the residual volume can't be measured by spirometry. Now the important thing in clinical significance. Okay, so it is very important in diagnosing, okay, any disease. Okay, we can also say that it's a footprint, okay, to diagnose many diseases. So in case of obstructive disease like in asthma or emphysema, the residual volume increases, okay, because the air get trapped in the lungs, and air get in but can't comes out. Okay, so the air get trapped and the residual volume increases. In case of restrictive lung disease, like in case of pulmonary fibrosis, okay, the residual volume decreases, okay, because the lung becomes stiff and the residual volume decreases. Now we'll talk in case of aging. Okay, so while natural aging occur, the elasticity or recoil nature of the lung decreases. Okay, and this lead to increase in residual volume. Okay, so this is all about our residual volume. Now we'll try to understand this figure, okay, from volume point of view. Okay, so this is tidal volume. Okay, so we all know that it's air that moves into lungs with its quiet inspiration. Okay, so this is your tidal volume. Okay, this much area is a tidal volume. Now we'll see this inspiratory reservoir volume. Okay, we all know that it is the air that can still be breathed in after a normal inspiration. So this is our normal inspiration. Now this much air, okay, this much air is which we still breathe after normal inspiration. That is your inspiratory reservoir volume. Okay, now we'll see this expiratory. So we all know that expiratory reservoir volume is that air that can still be breathed out after normal expiration. Okay, so after normal expiration, this much of air, okay, this much of air can still be breathed out. Okay, so this part is the expiratory reservoir volume. Now the last one is residual volume. Okay, so it is the air in the lung that will stay here. Okay, that will not comes out. Okay, so air in lung after normal expiration or exhalations. Okay, so this part is the residual volume. Okay, so this is all about this figure. So understanding these values is the footprint for diagnosing many respiratory diseases. Okay, so I hope this breakdown help you mastering the lung physiology about the lung volumes. Now before we go, okay, just remember that success is a sum of all small efforts repeated day in and day out. Okay, so keep pushing, keep studying, and you will get there. Okay, so if you found this video helpful, please like, share, and subscribe my YouTube channel. Thank you.